Reasons for failure of antiviral therapy. Reasons for failure antiviral therapy is first, drugs that target viral process must penetrate the host cell. Many factors account for the difficulty in developing antiviral agents. The structure of each virus differs, and specific therapy is often unsuccessful because of periodic changes in the antigenic proteins of the virus. The antigenic proteins provoke an immune response in the host. The need for a host cell to support the multiplication of the virus makes treatment difficult because the agent must be able to inhibit the virus without seriously affecting the host cell. Second is lack of broad-spectrum antiviral drugs. Third, lack of in vitro susceptibility testing procedures. Fourth, narrow spectrum. Narrow spectrum drugs target specific enzymes, polymerase, transcriptase involved in viral nucleic acid synthesis. Hence, development of resistance is easier. Point mutation to substitution of single important nucleic acid. Fifth is inhibits only actively replicating virus, unable to eliminate non-replicating or latent viral infection. Sixth is mostly virus static, hence success depends on host immune response. Synthetic nucleosides is the most successful use of antiviral drugs that either inhibit DNA or RNA polymerase or act as chain terminators after incorporation into nucleic acid. For the viral replication is RNA virus is the direct replication. Need virion enzyme for the viral RNA polymerase to synthesize the mRNA or viral RNA serve as mRNA. For the DNA virus is the indirect replication. Viral DNA transcribed to host mRNA by the host cell RNA polymerase. For the unique one is the retrovirus. Retrovirus make a copy of DNA from viral RNA with the help of reverse transcriptase. DNA is incorporated into host genome mRNA viral proteins. Most of the antiviral drugs are nucleic acid analogs and interfere with the viral nucleic acid synthesis, DNA or RNA, or regulation. Drug may also affect virus-specific steps like attachment to host cell, penetration and uncoating of virus in host cell, reverse transcription, virus assembly, and maturation, meaning that the majority of the antiviral medicines are nucleic acid analogs that disrupt viral nucleic acid production or control. The drug may also impact virus-specific stages such as virus adhesion, penetration, and uncoating in host cell. For the general approach to control viral diseases is to develop effective vaccines, but this may not be always possible, and in such cases, chemotherapy is the only alternative. The main objective of antiviral chemotherapy is to eradicate the virus with a little or no damage to the host and to prevent further viral infection. Only few antiviral drugs have been developed so far, which are somewhat safe and effective against limited viral diseases. Most of the drugs have been developed for human use and only a few have been studied in animals. In most of the acute viral diseases, the replication of viruses reaches peak when symptoms appear. Most antiviral drugs have greater effect against few infectious particles and show less efficacy when the disease is symptomatic. Therefore, antiviral drugs should be started early in the incubation period, or such drugs may be useful as a chemoprophylactic agent. So when the disease is symptomatic, antiviral medicines have a larger effect against fewer infectious particles and have lower efficacy. Antiviral medications should be started early in the incubation period, according to experts, or they could be used as chemopreventive treatments.